Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. Welcome back to the More Than a Pretty Face podcast. I'm Dr. Azi, and this is my amazing co-host, my nurse, Lacie.
Hey, everyone.
Hi, Lacie. How are you?
I am so good. I'm so excited for this episode. We're talking all things acne, which ties into some big news with the practice.
Yes.
And also, you guys stay tuned because we have an amazing giveaway that you'll find out more near the end of the show.
Yeah, this is going to be an opus episode. Well, this is a really touching subject to me personally, just because I struggled with acne both in medical school and after I had my two kids.
Oh my goodness.
So it really hits home for me. I struggled so much with acne when I was a second year medical student. I started getting these deep cystic breakouts like along my jawline, all over my neck. And, I'm darker skinned, so it would leave behind these hyperpigmented, discolored areas, the acne staining.
The stain.
It affected my confidence so much. For like 6 months, I was clinically depressed. Like, I didn't know what to do. I felt like anything I would do, it wasn't getting better. I mean, finally, I went to see a dermatologist and got on some treatments, but I never realized how something belittling like acne could really affect normal day-to-day life.
Yes.
Like, I didn't want to go out. I didn't want to wear makeup because it looked even worse. I just had a really hard time socially, but also just wanting to show up for class and all these things. So it really made me fall in love with acne. I absolutely loved everything about it. I mean, not acne the disease, but just learning more about it, because it is much more complex than people realize.
Yes.
And there are so many different types of acne that we don't really think about. We just think, oh, acne, that's supposed to be normal.
It's like the face mapping, right? So like stress, you get it in certain areas.
I think
hormonal.
Stress had a huge part in my acne, and not sleeping, because I was in med school, I was studying,
It's
there was a lot of stress. And I think hormones. Mine, I think, was hormonal. I never really had acne on my face when I was a teenager. I had it on my back. But when I became a young adult is when I started to really struggle with it. But there are really amazing treatments out there. So if you're one that is struggling with acne, you do not have to suffer.
No.
It can be really devastating, and there are amazing therapies today that can really help clear your acne. You get your life back, you feel better, because it is not your fault. Acne is not anything you're doing. It's not because you're clean. It's not because you're not using the right product. It is truly a medical condition. So see your dermatologist if you're struggling. You do not have to suffer, and you want to prevent acne scars, because one of my passions is treating acne scars.
Yes.
Which is really difficult for me and the patient. But we really want to prevent scars by treating acne early on.
I need to know, were you one of the patients that thought the stain was permanent? Did you call it a scar? I get that a lot.
Yes, that is true, because you see the little stains that are left behind. You do think, because I'm darker skin, and it would stay for months.
Yeah.
And some people get the red stains. So even when the pimple goes away, it still looks like you have a breakout because the mark is still there.
Yeah.
All right. So do you have a beauty and blemish? Guys, beauty and blemishes are when we talk about the most amazing part of our life, our beauties, and the not so pretty aspects, the blemish. So let's get into it. What do you think? Do you have something?
Oh, I do. So I love seeing our patients in the office, and even more when they tell me that they listen to our podcast. So we had a new patient in the other day, and she was like, "Oh, I know exactly who you are. I just binged all of your episodes on More Than a Pretty Face podcast, and I just heard your voice around the corner. I had to come say hi."
Oh, it's so nice.
The cutest thing ever. And then, of course, I also stalk our reviews, and she had just left us a review too. She's the sweetest. Shout out to Trisha.
Thank you, Trisha.
Thank you for listening and being a loyal patient.
It really makes us happy to hear your feedback, good or bad, because we really are doing this for you. And so your subscriptionship and listenership is really important to us. So please give us feedback, send us a review. And what about your blemish?
Oh, my blemish is somebody left us a 3-star review.
Oh,
you know, it happens.
good feedback.
He said, or she said, that we just talk too much and ramble on. I guess,
Me?
you know.
No.
I don't know. I guess.
Do I ramble?
So, I mean, this is good feedback. And we're going to put up a story. We're going to put up a poll on our Instagram. Do we talk too much? What do you like to hear? Do you like us to just dive right into the nitty gritty? Or do you like to hear about our day? I don't know. Tell us. We want to hear from you.
Be honest. Let us know.
How about you? What's your beauty and blemish?
My beauty is our AviClear Laser came in today.
Yes.
Or not today, whatever, a few days ago. Unfortunately, we couldn't get it through the door. It was so big, we had to disassemble it outside in the hallway.
We?
Oh, we, that's right. I meant Lacie and the team. It's always a we situation.
Yes.
We're in this together.
She films, I do the dirty work.
But nevertheless, it's in our office, so that is my beauty.
It's so exciting.
I'm so excited about the AviClear. It is the first FDA-approved treatment for acne. We're going to get into it in just a minute. So my blemish is, though, the other day I had this beautiful girl. She was maybe in her early 20s. She came into the office. She had a bandage on her face. And
oh, no.
You know, she's one of my acne patients. And I'm like, what happened? Like, what happened? She's like, I'm so embarrassed. I'm like, you gotta, like, why do you have a bandage on your face? She's like, well, I had a date with this really cute guy last week. But unfortunately, I got a big pimple, like right in the middle of my face. And this thing, she was like, it was big. It was right next to her nose, like close to the mouth area, you know? And so she was like, I decided that I'm going to treat it with alcohol and then spot treated it with Retin-A and then I put some benzoyl peroxide on it.
Stop.
I was like, wait, hold up. Is that all in 24-hour period?
What a cocktail.
She's like, yeah. And it continued for another 24-hour period. And by the 40th hour, I had this huge ulcer on my face. I was like, oh my God, why didn't you call me? She was like, I just didn't think I had enough time and I was just trying to kill this pimple.
You guys, the pimple shot. Come on.
I know. Well, you and I know this, but you know, there is a thing called the pimple shot. So if you get a big, juicy, tender pimple and you have something coming up like in a day or two and you need to get rid of it ASAP, call me.
Yes,
or
please
call your
us.
dermatologist. We can do a shot of Kenalog, which instantly reduces the inflammation, swelling, redness. It's almost gone in a day or two. Do not spot treat with a gazillion things that are caustic to your skin because this poor girl ended up with a scar now that we are treating a true scar because she caused a burn. The alcohol dehydrated the skin, got rid of all the protective oils. Then the Retin-A caused further irritation that disrupted her skin barrier. Then she threw in benzoyl peroxide.
Oh my gosh, I can't even
and just
imagine.
completely burned her skin. So do not do that. You can also use the zit roller.
Yes, my
which
favorite.
is like a little magic on a roller. If you can't get to your dermatologist, try spot treatment like the zit roller.
Yeah, I had one pop up over the weekend.
But I felt bad for her. You know, I'm sure she was really excited to go out with this guy. And she was like, oh my God. And it's those big pimples, you can't really cover them up with makeup.
Aw, poor thing.
All right. So what are we getting into?
We are going to get into Ask Dr. Azi.
Oh, I love hearing from you guys. I love your questions. So if you're on Instagram, you can go to More Than a Pretty Face Podcast. And if you want to get your questions answered on the show, be sure to send us a DM. You can actually also email us because not everybody's on Instagram. You can go to More Than a Pretty Face Podcast at gmail.com. And we're so happy and excited to answer your questions on the show.
We love hearing from you guys. Our first question is from Anthony, and he writes, Dr. Shirazi, I have bad cystic acne, and I'm ashamed of my skin.
Aww.
I know. I'm afraid of going on Accutane because of the side effects, but desperately want my skin to heal. What can I do to help my skin without going on medication?
Well, Anthony, my heart goes out to you because I know how it can affect you mentally.
Yes.
And when your mental health is affected, that affects all aspects of your life. So one, I know where you're coming from, But 2, unfortunately, if you have deep cystic acne, the type of acne that's below the surface of the skin, that is in the deeper skin layers. And there is no amount of amazing topicals you can use that will really have any benefit, because you need an oral agent or a treatment that goes beyond the surface of the skin. So you absolutely need some oral medication, or, speaking of AviClear that we just got, you can do a laser treatment like the AviClear, which works very similar to Accutane. It's a laser that targets the oil gland. So just like Accutane targets the oil gland, AviClear does the same thing. What I like about it is you don't have to do any lab work, because with Accutane, it's a 5 to 6 month commitment. You have to get blood work because there are potential risks and side effects, such as affecting your blood counts, affecting your liver, affecting your immune system and your lipids and triglycerides, which could affect your pancreas. So there are a lot of potential risks and side effects. And I'm not saying it's bad. I love Accutane. We have hundreds of people on Accutane every single month. It is life-changing. So if that is what you need to do it, because it will be the best decision you'll ever make. I've never seen Accutane not clear up someone's skin. But the things you need to know is that you do have to do blood work before you start it and during your treatment. And you have to get registered with the iPledge program, which is a program where you have to check in with your doctor once a month to get the medication. And we have to monitor you for the potential side effects and risks. So AviClear, which is very similar, is 3 sessions. And the laser works beneath the surface of the skin. So it doesn't matter if you're dark-skinned, light-skinned. There's no downtime really, because again, it's not doing anything to the surface of the skin. It is going beneath the skin. So it's 3 treatments, about 3 weeks apart per treatment.
I have a question.
Yeah.
They market it, and correct me if I'm wrong, you do not need to be on medication with AviClear.
No.
You still see amazing results. And so if you are really truly terrified of taking oral medications, this should be...
Or doing blood work for Accutane, if you're not one of those that just can't do blood work.
This really could be life-changing treatment for you.
That's right.
Yeah.
So this is actually the first FDA approved, not FDA cleared.
What's the difference?
So FDA cleared means that it is safe to use, but there has been no studies that prove it works. FDA approved means that clinical studies have shown that 80% of people cleared on AviClear after 3 treatments. So that means it is approved for acne. So it's not just safe, but it actually works.
That's amazing. Those 80%, that's huge, you guys.
Yeah, so I'm super excited to be able to offer this to patients. It's just another treatment option for them.
Yes.
If you're struggling with those deep cystic scarring acne condition.
I will say, like, my favorite part of being a nurse is seeing these transformations and hearing how happy patients are and how life-changing it is for them. It's like the best feeling ever.
It really brings us so much joy. I mean, we could show you some amazing before and afters, and I love how the afters, they almost look like a different person.
They do. They're glowing. You can see it in their
happy.
eyes.
They're, they have a smile. They've done their lashes. They've done their hair. It just, confidence is everything in life. If like you have confidence in yourself and you feel good about yourself, you can conquer the world. Yeah. So that is why I love acne, meaning I love treating acne. I love seeing that transformation, not just in their skin, in their life, right?
Yes. Oh, I love it. All right, our second question, you guys, comes from Hannah, and she wants to know, can you explain the different types of acids, the glycolic, the azelaic, the salicylic, and also when to use these?
That's a great question.
That's a great question.
Glycolic and salicylic acid, these are exfoliating acids. And what they do is they remove the outer dead skin layer. So they help brighten the skin. They prevent the skin from clumping and clogging. They also can send signals down to the dermis to stimulate collagen. And they smooth the skin. They help with skin texture. They treat the very first sign of acne formation, which is the clogged pore. But they also allow your other treatments and skincare to penetrate better.
How do you know?
There's a lot of
Which one do you
So there are a
use?
lot of different types. So I would say if you have normal skin, sun damaged skin, then glycolic acid is awesome. If you have hyperpigmentation, it just brightens the skin. If you have acne or acne prone skin, salicylic acid is the treatment for you. It is
Okay.
oil soluble. It gets into the pores and really dissolves that gunk that's in the pores.
Mhm.
If you have sensitive skin, stick with mandelic acid as an exfoliant, or if you have dry skin, lactic acid is a great one.
What about azelaic?
Azelaic acid is great if you have rosacea or super sensitive skin. That's also a gentle exfoliant, but it does a great job of treating acne and rosacea.
Okay, now put this in a regimen for us. Like, how would we use this?
Yeah.
Can we use these acids morning and night?
So it depends on the strength and the formula. So there are some really high concentrated acids that you want to just do once a week. If you are using a formula that's more gentle and you have acne prone skin, then using it daily might be okay. You just have to make sure you're not also using other strong actives like a strong retin-A that's prescription at the same time, because the combination of the two might be too much for a lot of people's skin.
Okay, our third question comes from Hudson. And Hudson asks, I was wondering if I have to double cleanse. I'm a teen with acne and only wear water resistant tinted sunscreen in the day. And I have dry acne prone skin.
This is a great question. I really do think you should double cleanse if you're wearing sunscreen, especially some of the ones that are water resistant and they're hard to come off. I love double cleansing at night because I feel like clean skin is healthy skin. It really preps your skin for your actives in your nighttime routine. Plus, if you wear makeup, you just want to make sure all that comes off at the end of the day. You can skip cleansing in the morning, but once a day, double cleanse. And what I would suggest for you, if you're not wearing makeup, I love Purify, which is a hydrating, it almost has this silky lotion-like texture. But here's what you're going to do. You're going to put it on dry skin, okay, like a lotion. So at the end of the day, you're going to put it on dry skin and you're going to rub it in, and then you're going to take water and rinse it off.
What? Why? Why dry skin?
Because it allows it to dissolve the sunscreen and the makeup, almost like a lotion, you know, it interacts with that. You're not diluting the cleanser. That's
Right.
essentially,
Okay.
you're really putting on a concentrated amount of the cleanser to dissolve all that gunk off.
I need to start doing that.
Not with every cleanser, but I know Purify, because of the texture, it's the
Yeah.
silky, hydrating texture.
It's my favorite cleanser.
It's how I use it.
Yeah, I love that. So, with that knowledge, what else would you do? Give us an AziMD skincare regimen.
So you use a cleanser. Now, you don't have to use a Purify from us. There's also like Cetaphil from the drugstore you can use that is almost like a gentle cleanser. So any gentle cleanser that's very hydrating you can use. And then if you have oily skin, I know she has dry skin, but you can also use micellar water as your first step and then follow with a gentle cleanser like Purify.
That's only if you have oily skin.
Well, sometimes those with oily skin really love micellar water because it's so light.
Oh, okay.
But she has dry skin, which is why I
Right.
recommend Purify. So you can follow that up with Clarify pads, which have glycolic and salicylic acid in them. And you can sweep the face with that and then moisturize. So I love Purify, Clarify, and then Intense Recovery Complex. So my philosophy is you want to cleanse, treat, and then protect. So those are your 3 steps.
I love it. You're also all about simple and effective skincare.
Keep it simple. If you have acne, do not use a million products. Do not use a million steps, because having acne means you have a disrupted skin barrier. So it doesn't take much to really compromise that barrier and make your acne worse. So simple is always better.
Yes. And you guys, because we love you and we appreciate you guys listening to us, we are going to set you up with an AziMD skincare routine, all the products you need. We're going to give away a skincare kit to one lucky listener. We're going to post the giveaway on our Instagram, so make sure you follow us at More Than a Pretty Face Podcast.
Yes, I love that. And you know, Purify, Clarify, and Intense Recovery, that is a great regimen, whether you have acne or you just want to help with your skin texture. It's exfoliating, it's hydrating, it restores your skin barrier, it's simple, My teens love the Clarify pads because
Yes.
it's like one easy sweep and you're done.
I'm not going to lie. I love the Clarify pads.
Yeah.
At bedtime, if I am lazy and don't want to wash my face, I just scrub them down. I know I shouldn't tell you guys that for acne prone skin, but you guys, the post is going up today, Wednesday, May 10th. Make sure you go to our Instagram at More Than a Pretty Face Podcast, comment, and that's how you enter. And then we're going to announce the winner on May 12th, Friday, May 12th.
Yay. Good luck, guys.
We can't wait.
I can't wait to see who wins.
I
Good
know.
luck, guys.
Thank you, Dr. Azi, for answering our questions. Thank you to our community for listening and sending us your questions. Again, if you're just tuning in or it's your first time listening, we love hearing from you. Please reach out to us with your questions at More Than a Pretty Face Podcast on Instagram, or you can email us at morethanaprettyfacepodcast@gmail.com.
All right, guys. Until next time.
Bye.
Bye.